Hey guys, it's Sarah here. In this video, I'm going to be going over the lab values that you have to know for the NCLEX-RN. Included in this, we're also going to go over the cranial nerves. So before I get started, I just want to let you know that all this is available in a PDF form at my website, www.sarah.rn.com, and that's with an H. And also, if you can't find it, just look at the description box below and you could click on the link. So let's get started. Okay, so first we're going to talk about vitals. So just a prefix to all the vitals and all the lab values and everything else like that. It's a range. So in general, you don't have to know exact number. It's not like, so let's just say the blood pressure, 120 to 140. If someone's blood pressure is 118, it's not going to be like, oh, now it's out of range. It's basically like a parameter. It could be a tiny little bit more, tiny bit little less. It won't make a difference. So the NCLEX won't, so if it says like 12.5, you don't have to memorize 12.5, just be like till 13 or something like that, because you just have to remember the range. You just have to make sure someone's not too high and not too low. The only places you have to be particular in the exact value is going to be like some electrolytes, let's just say potassium. So potassium is an electrolyte that affects the heart, that if it's a little bit out of whack, it could affect the heart, or sodium and stuff like that. But your regular lab values, you don't really have to know exactly 1 or 2 or 5 off. So let's get started. So the first vitals we're going to talk about is the blood pressure. The blood pressure, the systolic, which is the top number, is supposed to be between 120 and 140, and the diastolic is between 80 and 90. If you have someone who's more conditioned or smaller, like a tiny little girl or something like that, you're going to have a lower blood pressure, or someone who's more conditioned like an athlete. Over those numbers are hypertension. So then we go on to the pulse, which is the heart rate. Normal is 60 to 100. If someone's too high, they're tachycardic. Causes of that could be like pain, fever, stuff like that. If they're below 60, that's bradycardic, and that could be caused by vagal maneuver. So like they're straining on by the bowel movements, or it could be normal for an athlete because their heart's conditioned. Temperature, normal temperature is 97.7 to 99 Fahrenheit, and for Celsius, 36.6 to 37.2 Celsius. Usually a fever is above 100.2. Oxygen saturation, so normal is 95 to 100. Someone with COPD could live on a little less. But it definitely shouldn't be under like 88 or anything like that. Capillary refill is the amount of time it takes for it to refill, pretty much. So you're gonna like press down on the skin, pick up, and you'll see it should bounce back in less than 3 seconds. Okay, so question, what is 98.1 Fahrenheit in Celsius? Okay, so the way you do this is you take the number in Fahrenheit, you minus 32 times 5 divided by 9. Just memorize that. So you'll have 98.1 in Fahrenheit, you minus 32, that gives you 66.1, times 5, that gives you 330.5, and divided by 9, that gives you the answer, which is 36.7 degrees Celsius. Okay, now we go on to CBC and labs. So CBC, let's start with the white blood cell count. So that is between 4,000 and 11,000. If someone's too high, then they usually have an infection going on. It doesn't tell you what type of infection or where it is, but just they have an infection. If someone's too low, then it's telling you that they're at risk for infection. The platelets, 150,000 to 400,000. Absolute neutrophil count, which is ANC, 2,200 to 7,700. I wouldn't really know the number. I would just know that neutropenia is when it drops below 1,000, and if it's below 500, then it's critical and it's severe. It's like an emergency because they could get anything can make them sick and they can't fight against it. Eosinophils are 1 to 2%, and leukocytes are 4,000 to 11,000. Leukopenia is less than 4,000. So what I would just know from this is really the white blood cell count and the platelets. That's the main ones I would know. Okay, now we go on to the labs. So the albumin is 3.5 to 5.4. If someone, it's basically showing you how well nourished they are, like if they're on starvation or stuff like that. The BUN is 6 to 20, that I would know. So like I said before, you may see somewhere it says 5 or like 19. It's basically a parameter, and the BUN, the creatinine, which is 0.6 to 1.3, is showing you how well the kidneys could filter. So if they're not filtering very well, then it'll be elevated, or if they're dehydrated, etc. Hemoglobin is different for males and females, but like I said, I would honestly just know the range. I would tell myself like hemoglobin and normal is between 12 to 16, like that. But you can memorize each one. I can't promise you it won't be on there, but in general, you just have to know like ranges. If someone's hemoglobin was too low, then they might need a blood cell, like a red blood cell transfusion. And it also would indicate anemia. ALT, so ALT and AST are going to be your liver enzymes, so they'll be high in like an alcoholic, someone on Tylenol all day, like that. That is 10 to 40 ALT. The urine specific gravity is a specific number, so this I would know. 1.003 to 1.030. So urine specific gravity is basically like how concentrated it is. So if they're dehydrated, up; if they're diluted, it will go down. ESR, erythrocyte sedimentary rate, is supposed to be below 20. It's just trying to say if there's any inflammation going on in the body, which is also CRP, C-reactive protein, less than 10. So from this, I would just know BUN, creatinine, hemoglobin, I would know the ranges a little bit, and urine specific gravity and ALT. And then just know what everything else is. Like ESR, just know it's inflammation. Albumin, just know it's like the starvation one, like that. Okay, so ABGs, arterial blood gas. So this is actually going to be given from an artery. So in general, you get blood from a vein. You stick someone, you put IVs in, you get blood draws, all from veins. An artery is going to be your ABGs. And this is going to show like your oxygenation status, how well they're ventilating, if they're in an acid or base imbalance. So pH is going to be 7. So these you have to know exact values. 7.35 to 7.45 is your pH. If it's low, then so it's like 7.31, then it's acidic. If it's high, over 7.45, it's alkalosis. PaO2 is supposed to be between 80 and 100. PaCO2 is 35 to 45. If it's too low, it's alkalosis. Too high, it's acid. The bicarb, which is HCO3, 22 to 26, too low acid, too high alkalosis. So I just like to remember that the pH, if it's too low, it's acidosis, and I just like to remember CO2 is acid. So if it's too high, it's acid. And then just remember that they go in an inverse relationship, and the pH and the bicarb are together. Okay, question. So the patient with the following ABGs, pH of 7.5, PaCO2 of 20, and the bicarb of 15. What condition does the patient have? So I'm going to give you a minute to figure this out, but also if you want to have a really good video on ABGs, I'll link it above, and it's more like in-depth. This is just like a lab, so I'm not going to spend that much time on ABGs, but if you want an actual ABG video, I have one above. Okay, so first you're going to look at the pH, and then you're going to look at what else is off, and which direction. Is it too high, too low? If they're both off, then which one matches the pH, and then you know what condition it is. So the pH is going to tell you if it's alkalosis or acidosis, and the bicarb or the carbon dioxide is going to tell you if it's respiratory or if it's metabolic. And if they're both off, then it's going to be partially compensated. So over here, So like I said, like in the video above, we'll go through everything. This is kind of just to go through the labs. Okay, so here are other lab values I would know. So BMI is, normal one is 18.5 to 24.9. Someone's underweight or someone's obese. Normal urine output. This I would know the exact. This is very common and tested a lot, especially when it comes to kidney patients, etc. So 0.5 to 1 milliliters per kilogram per hour, or you want more than 30 milliliters per hour. The next one is CD4 count, which is 50 to 1,200. So this is talking about like when someone has AIDS or HIV, they're going to have a low CD4 count. The glaucoma scale, normal is 15. It's graded, like based on eye opening, etc. And you want them to be completely alert, so 15. Deep tendon reflexes, normal is 2+. The thyroid stimulating hormone, normal is 0.4 to 4.2. Intracranial pressure is 0 to 15. You don't want it to get too high, like we discussed in the conditions. So just that you should know, for the glaucoma scale, the normal is 15, but the range is 3 to 15. So you can't get a 0. It's not possible to get a 0. If they're the worst they could be, they get a 3. Under 8 is considered critical, and 15 is the best. So over here, I would just know the glaucoma scale, the urine output I would for sure know, and the intracranial pressure. Okay, now we go on to cardiac and stuff that have to do with the cardiac labs. So fasting total cholesterol should be below 200. The LDL, which is the bad cholesterol, should be below 150. The HDL, which is the good one, should be above 40. The mean arterial pressure. So this is the MAP. This should be between 70 and 105. I would know the exact numbers and I would know how it's calculated. It's calculated by the MAP, just commit this memorization, is the systolic blood pressure plus 2 times the diastolic over 3. So if they give you a blood pressure, you should be able to figure out the MAP. You always want the MAP above 70 or for sure 65, 70. Troponin should be below, it says 0.4, but really it should be below 0.2. It's an indicator of heart, like a heart attack usually. CKMB is also an indicator of a heart attack. Then we go on to the D-dimer. It should be below 500, and if it's elevated, it can indicate a clot, like a pulmonary embolism. Then we go on to BNP. It should, if it's more than 100, it shouldn't be more than 100, but if it is more than 100, it indicates heart failure. The cardiac output should be 4 to 8. Central venous pressure should be 2 to 8. Pulmonary venous wedge pressure should be 6 to 12. And the pulsus paradoxus is basically when you have an exaggerated fall in systolic blood pressure of more than 10 during inspiration. So what I would know from here is I would know for sure the cholesterol, the LDL, the HDL, for sure the MAP, and BNP more than 100, and then I would just know what they indicate. So like I would know CKMB has to do with the heart, the D-dimer is a pulmonary embolism or a clot. I would just know what they are telling you about. Okay, so here's a question. So the blood pressure is 105 over 67. What is the MAP? Okay, so the MAP, like we said, is the systolic plus 2 times the diastolic over 3. So the systolic is going to be 105, and then the 2 times diastolic is 67 times 2, so that's 134. So you're going to plus that with 105 and get 239, and divide that by 3, which gives you 79.7, which is a normal MAP. So that means that they're getting enough oxygen. Okay, so here's bleeding and clotting. I actually have a really good video, like under 5 minutes, and I explain all this really clearly. But I'll just really run through it just so we have the labs. So APTT is activated partial thromboplastin time. So this, just know, it has to do with heparin, and therapeutic level on heparin 46 to 70 seconds, which is 1.5 to 2 times the base value. If it's too high, you want to be concerned about someone is bleeding, and this is just the newer version of PTT. PT, on the other hand, is done on warfarin. The therapeutic range is 11 to 16. And INR is on warfarin also, and it's telling you how fast the blood's clot. If it's too high, that means it's taking a long time to clot, so the patient could bleed out. If it's too low, that means that it's slow, so clots are forming. This could be affected by antibiotics, and the therapeutic level on warfarin is 2 to 3. So like I said, if you don't understand this, I have a really good video with a mnemonic that could help you memorize all this in less than 5 minutes. Okay, so then we go on to glucose and electrolytes. So the fasting glucose, if they didn't eat and you check their blood sugar, it should be between 70 and 100. The hemoglobin A1C, which is basically telling you their average sugar over the past 3 months, because someone could be like, oh, today I'm going to eat good, and they'll have a good blood sugar, but it doesn't mean that they've been good for the past 3 months. So the hemoglobin A1C should be under 7 for a diabetic and 4 to 6 for a non-diabetic. For someone critically ill or someone on TPN, you want the glucose to be higher, like 140 to 160, but you don't have to memorize that number. Okay, then we go on to electrolytes. So electrolytes, I would know the exact number, the exact range. Sodium, 135 to 145, calcium, 9 to 10.5, phosphorus, 2.5 to 4.5, potassium, 3.5 to 5, and magnesium, 1.5 to 2.5. So I actually also have a video on this where I go through all of them, how to know and what the symptoms are, if it's too high and too low. I'm just letting you know about like all these extra videos that I have, because if you want to know them more in depth. So like more in depth and understand it, what's too high, what's too low, what causes it, etc. Okay, so then we go on to infants. So infants, which is under 1 year old, these are very specific to them. You want them to have wet diapers, 6 to 10 a day, or 1 every 4 hours. You want the urinary output, which is very important in infants because it could show you how dehydrated they are, 2 milliliters per kilogram per hour. A normal newborn head circumference, because they like to test on newborns, is 12.5 to 14.5. Their pulse is going to be higher. So usually for an adult, tachycardic is anything above 100, but they actually start at 100 to 160 is normal. The respiratory rate is also higher, 30 to 60. The hemoglobin is 12.5 to 20.5, and the temperature is pretty much the same. And the blood sugar within the first 24 hours after delivery, you want it 40 to 60. Okay, so then we just go over 6 rights of giving medication. The right patient, drug, dose, route, time, and documentation. So I just remember that. PDD, RTD. Patient, drug, dose, route, time, documentation. So here's a question. How could you make sure you're giving the right medication to the right patient? So number 1, ask them their name. Number 2, look at their room number, check their wrist, or have them say their name and date of birth. So it's going to be D because you always want 2 patient identifiers. So they should say their name and date of birth. Okay, so the cranial nerves. In the next slide, I'm going to show you pictures which are going to help you remember it. But just know the first one, olfactory, smell, 2, optic, which is sight, 3, oculomotor, which is moving your eyeballs, 4, trochlear, which is moving the eyeballs. Sorry, 3 was moving the eyelids and eyeballs. This is moving the eyeballs. 5 is a facial muscle, so like chewing sensation on the face. 6, abducens, so the eyes again. 7, facial, so taste, tears, saliva, your face expressions. 8, vestibulococal, which is hearing. 9, glossopharyngeal, which is swallowing, saliva, taste. 10 is a vagus. 11 is accessory, so moving your head and your shoulder. And 12 is hypoglossal, which is tongue, so the speech and swallowing. So this is a really good visual that I came up with. I mean, not like I didn't come up with all of them, but you have one nose, so that's one is going to be talking about olfactory, which is your nose, smelling. You have two eyes, so number 2 is going to be eyes. 3, 4, 6, your eyes do tricks, so those are going to be like all have to do with your eyes also. 5, it rhymes with tri, so trigeminal. 6 we already did, so 7, if you look at the 7, like over here, if it's perfectly in a face, so just remember facial. 8, the letter 8 is twisted like an ear, so you remember acoustic. 9, so that's like a little far-fetched, but I just remember G, so G is for gag reflex and the glossopharyngeal. And a G looks like an upside down 9, so just remember 9, G, and then remember the gag reflex. 10, so how I remember this is 10, so like 10 out of 10 you would give if you go to Las Vegas. So 10 would be the vagus nerve. 11 would be spinal accessory, so just look at the picture over here. I put like 1 and 1, so 11, which is like spinal accessory is the shoulder. And 12, so 12 I think of someone in puberty age, and I think of like a teenager chewing gum and speaking disrespectful. So that's going to be like the 12th nerve, which is like chewing and talking, etc. Okay, so I hope that helps you. Please like and subscribe, and stay tuned. And like always, if you want all this in a PDF form, just look at the link below or go to my website, sararn.com. Thank you.